CDC chief asks Americans to mask up again. The CDC director is once again asking Americans to mask up. America's leading public health official is recommending Americans to wear a mask this flu season to stop the spread of illnesses such as COVID, the flu and RSV. Mandy Cohen, MD, MPH, director of the Centers for Disease Control and Prevention CDC, said in the video posted to her social media accounts that Americans could take precautions to protect themselves against respiratory illnesses heading into the holidays. To protect yourself and your family this holiday season, take the steps that we do every year to protect ourselves. Get your updated COVID and flu vaccines and your RSV vaccine if you're over 60. It's not too late to get vaccinated if you haven't already, she said. She continued, use additional layers of protection like avoiding people who are sick, washing your hands, improving ventilation, and wearing a mask. Masks have largely fallen by the wayside in the U.S. A regular sight during the first 2 years of the pandemic, mask orders have largely vanished across the U.S. Just a fraction of Americans still say they regularly wear a mask outdoors. However, Dr. Cohen's warning comes as the CDC once again reported a sharp increase in COVID hospitalizations this week. The number of Americans hospitalized with the virus increased 11% during the week that ended on November 25th, an increase of around 20,000. This increase in COVID cases, combined with the ongoing flu and RSV cases around the U.S., have been dubbed a triple-demic by some health leaders. In total, this respiratory virus season has led to 70% of hospital beds in America being occupied at present. It's that time of year again when we're seeing a lot of respiratory illnesses like flu, RSV, COVID, and pneumonia, Dr. Cohen said. In the United States, RSV is elevated, flu is continuing to increase in most of the country, and COVID is starting to increase again after being stable for the past few weeks. The CDC chief also mentioned pneumonia, referring to a global increase in pediatric pneumonia cases being detected worldwide. First emerging in China last month, the U.S., Denmark, Netherlands, France, and Ireland have also experienced upticks in cases. These pneumonia cases have largely been blamed on the regularly circulating illnesses and bacterial infection caused by Mycoplasma pneumonia. Right now, we're not seeing anything new or unfamiliar in terms of virus or sickness, she reiterated to Americans, quelling fears that the uptick in pneumonia cases could be tied to a new pathogen circulating.